Absolutely. And as you said, I mean, the province is definitely one of the harder hit provinces. To give you some example of that, we're seeing this, we're beginning to see the snowballing effect of that exponential rise of cases that you were talking about. We've seen yesterday, for example, for over 4,000 new cases in the province on one day alone. And obviously, that's taken our active cases over to just around 37,000 active cases. And that translates into significant pressure on the health platform. Over the last 2 weeks alone, for example, we've seen around 1,000 deaths in the last 2 weeks.
Yeah.
So obviously, there's significant pressure on the Western Cape health services, public and private.
Yeah. Mr. Karim, the health system is obviously taking strain. Just 2 days ago, the head of health in that province, that's your colleague, Dr. Keith Klute, he called for, and I quote, a radical intervention to safeguard both the public and private hospitals. I just want for you to give me one answer on this as to what kind of intervention is he calling for when he says there needs to be radical intervention in order to safeguard these health institutions there?
Well, one of the things we're thinking of obviously is the impact on the movement of people and gathering. So that's definitely one of the interventions that we think need to be curtailed. If alcohol and banning the alcohol sale of alcohol again is a second one, and just basically making sure that people don't move around the province, and also obviously that applies to the country as well. Uh, we also can talk about the health sector in terms of radical interventions inside of the health platform, and we
Sure.
can come to that in a minute as well.
All right. Maybe let's delve into that, because I want to stick with the safeguard of the healthcare system in your province, because you obviously are experiencing pressure at this time.
Absolutely, and I mean this, as we can see, because of that rapid increase and exponential rise in cases, the pressure on the public and private health systems in the province is under significant strain. The number that you put up there, 2,859 admissions as of late yesterday evening, and early this morning, a lot in the public and the private sector. We have in the public sector roughly about 5,000 acute care, general acute care beds that are available. That if we exclude the specialized beds in the province, within that 5,000, we have to make sure we provide sufficient care for COVID cases, non-COVID, as well as the significant trauma that we experience in the province, and particularly over this festive season. So our strategy, and one of those radical strategies that we're thinking about, obviously inside the health platform,
Yeah.
is to de-escalate and repurpose some of those beds for COVID care.
Mr. Klute, you've already touched on it, and I want to continue with it. The Premier of the Western Cape, Alan Winde, sounding the alarm around what he says is the healthcare and frontline workers who are experiencing pressure and are taking strain at this time. What is being done to try and alleviate pressure on them?
We got a number of strategies in place, so we're trying to, as far as possible, just to give you some idea of that kind of pressure. In this last week alone, we had 495 new health workers test positive for coronavirus. And obviously that has a cumulative impact. So at the moment, we've had in total about 6,400 healthcare workers test positive. So what then happens is those workers are off, they're out of the system, and therefore it adds pressure and adds a significant amount of strain onto the platform. What we're doing to alleviate that is we are rapidly in the process of employing additional, particularly nursing staff, which is where the highest burden and toll is, additional nursing staff via contracts. As you know, towards the 1st of January, we'll get additional staff that have just qualified. So we're rapidly employing them on contract to help alleviate the pressure inside of the health service platform. And obviously, we're also trying to support our healthcare workers through, in fact, we just started now recently on-site psychological counseling support for anyone whom anybody feels has possibly decompensated or taking personal strain, or where the system's taking strain. And we've given really positive messages of support to our healthcare workers across the province.
Yeah. Beaches remaining open, is that helping the situation?
The beaches remaining open. Obviously, that's one of the places where people gather. But obviously, beaches being open air, being fairly reasonably well controlled. We've got local law enforcement who are patrolling the beaches on a regular basis, and they obviously ensure compliance with masks, etc. So make sure that people are that to minimize the risk on the beaches in the province. But what's more concerning is indoor gatherings, and that's with Christmas tomorrow and New Year coming up fairly soon. We are very concerned about indoor gatherings where there's poor ventilation and and there's little or no social distancing taking place. I like the picture of the beach. I think that's Sea Point. It looks like Sea Point, yes.
Yeah. Look, Mr. Kariem, I want us to explore this with all honesty. Yes, you're saying beaches, it's the outdoors, and chances of this virus being transmitted are perhaps minimal. But we do have a new variant, and it does appear that it is being passed on quicker than what the original state of this coronavirus was at the beginning of the year. I want us again to talk about these beaches being open because the Premier, Alan Winde, was calling on the public to step up and play their part. All of this in trying to help alleviate the pressure on the healthcare staff who are at the forefront of this fight. Surely, that is a contradiction in a province that is seeing numbers spiking.
Sure, no, but if one does a risk assessment of the public spaces, it's not only beaches. It's obviously all public spaces, and that's hence the call for the reduction in gatherings and limiting the movement of people. The risk remains higher, though, as I've said, indoors with poorly ventilated spaces in pubs and restaurants and bars. And from a risk assessment perspective, that obviously does represent a far higher risk. We also have, besides the law enforcement, we also have a very active messaging campaign to help, I guess, inform the public to help make better choices this festive season and over the holiday period.